Good morning, everybody, and welcome to Constellation Quality Health Quality Leaders Series. We're very excited to have you, and we're very excited to have Cindy Frakes with us today. Before we start our presentation, just a couple of reminders of upcoming sessions. We have Beth Hersher presenting, or Beth Hersher and team presenting next session on the 28th, some of the best practice staffing and retention guides that we have coming out of Leadership Academy. She'll come back on October 22nd and November 9th to continue to share those best practices. The Leadership Academy is finding a lot of really good information and resources and tips that are available. And as we are all struggling and working through staffing challenges, it's always good to network and collaborate and share some best ideas. As a small little push, if you know anybody, we are currently accepting applications for Phase 3 of the Leadership Academy work that will be provided by Beth Hersher and team. You'll receive consulting services by BNF Consulting on leadership tips and techniques to assist in staff retention and frontline staff. On October 12th, Julia Brooks will be presenting on maintaining an effective skin program. This is a big area of opportunity and one of the top 10 citations that we're seeing about skin and skincare. Not unusual given challenges that we have with staff, new staff coming in, new practices being learned. It's a good opportunity for us to just take a moment, reflect on our skin protocols and skin programming, and bring that back to the forefront of what we do. But without further ado, I do want to introduce our speaker today. We're honored to have Cindy Frakes joining us. Cindy is one of our board members on the post-acute care consulting group here at Constellation Quality Health and is a member of NICE, a subset of the National Association of Healthcare Assistants. So a great organization, some fantastic resources for our frontline leaders and caregivers out there, and a really nice opportunity to hear a topic that is really beneficial to all of us. How do we really transition from the task focus of completing the facility assessment into really making it a strategic process and opportunity for us? So without further ado, I'd like to thank you and welcome Cindy to our conversation.
Good morning, and it's an honor to be here and to be asked to do this, especially for me, as I am a retired nursing home administrator with about 25 plus years operating an SNF or a couple of different SNFs. I did not move around a lot in my long-term care career. I did many years in the same facility after having moved around a few times, and that's another story for another day. But basically, when I decided to stay in the same place rather than going to the next opportunity, it was because I had a kind of an epiphany. I wonder what it's like to clean up my own mistakes, and actually stayed and did that, and is a series of life learning lessons from there, and had a blast in a great facility with a great bunch of people in a wonderful place to work. After that, I owned and operated for a short period of time a Home Plus here in Kansas. That's an adult care home that is done in a residential setting. Many states have the rules to allow for that. And here in Kansas, they're called Home Plus. I tell people that was the hardest job I ever had in my life. I left 120 bed high acuity short stay SNF that did 15, 20, 25 admissions and discharges a week. I thought operating a 6-bed Home Plus was going to be a cakewalk. I was in for an eye-opening experience. But it was a lot of fun. I sold that and did a few years in the pharmacy business and a few years at Cerner, the electronic health record business, before I retired. And so I did not work through the COVID public health emergency, and have often said that I wonder what learning lessons I missed, and often said I'm really glad I missed them, because I know it's been a rough stretch of time, and that everybody's working really, really hard to climb out of that. But I am very, very honored to be here today with my old, rusty, retired administrator self. I was asked to talk about facility assessment because I made a comment from the time I first read the draft regulations for the 2016 ROP revisions. I loved the facility assessment regulation. It just jumped out of the conditions of participation and screamed at me, oh my gosh, CMS is taking a different approach. And grabbed a hold of that and have talked about it since then, and had the honor to work with some people on the development of some tools for completing the facility assessment. But basically, it is my favorite regulation. And people sometimes think I'm a little bit odd when I say that, and that's okay. I probably am a little bit odd. And when I was asked to speak about this, I thought, why? And why would I want to do this? And it's because I'd like to inspire that sort of thinking in others, and to also talk about how using a tool like the facility assessment can help you get out and generate more conversations in the day, during the day, every day, with direct caregivers and other frontline support team members, residents and their family members, everyone, and to see and listen to how they do what they do, where they do it, what they do it with, and to really get into the nuts and bolts get a deep understanding of the nuts and bolts of your operation, and how to ensure that on any given day, under any given set of circumstances, that you can do the best possible job. The other thing I wanted to bring today was maybe a couple of links to unusual sources of data or information that can be used to help with that facility assessment process. I see the facility assessment as an expansion of a business plan, and for those folks on the phone that are business educated and trained people, they know what business plans are. Many leaders in long-term care come from clinical backgrounds and don't necessarily think about business plans, but a business plan is your marketing plan, your operating plan, your staffing plan. It's your disaster plan. It's all of those elements that you work on from a task list. Your business plan puts that all together and says, what are we going to do? How are we going to do it? Who are we going to do it with? Why are we doing it? And how do we do it well? And becomes your roadmap to success for that. So sometimes you need to get outside the box of healthcare to find information to help us deliver better healthcare. In the next slide, I think, I don't know how the best way to, you want me to just say next slide and not try to be transition cute here? I think that fundamentally, the facility assessment regulation, which is F 838 or 483-0E or 70E, is defined by CMS in their own words to enable you to competently care for residents 24 hours a day and during emergencies. They specifically say that. And that sounds simple, but that's actually a really big job, especially identifying the differences in the needs across days, across shifts, across, considering holidays. And then when you bring in disaster planning and being well prepared for what disasters are likely to occur or could occur, and knowing the difference, and then getting all that information out to all those hundreds of people that deliver the care and receive the care every day, so that they too feel informed and can articulate and perform their duties under whatever circumstances arise. Go ahead and go to the next slide. Being a requirement is not the thing that I wanted to talk about today. I know you all know this regulation. It's not a new regulation. It's been around for a couple of years, although its implementation was interrupted by the public health emergency. I think it also became a flag flying above the requirement saying, and this is part of the reason why we need facility assessment, because we need to be ready for whatever gets thrown at us on any given day. If we're not, we're going to do a disservice to someone, either a caregiver, a resident, a family member, ourselves, our community. We have an obligation to be prepared. That's not why I like the regulation. Regulations historically, and when I first started working as one of the advantages of being this old rusty retired person is when I first started, the survey had about a 36-page. I almost looked it up because I know it's still out there on the internet, but there was a gray and white paper form that the inspector walked in with that was maybe 50 pages, maybe. And it was a bunch of regulatory requirements on the right-hand side and a box that said met, not met on the left-hand side. And I probably have that left and right backwards. Forgive me, I'm left-right impaired, especially when I'm looking at us out towards people or things. But they came in, they worked down through this list. There was one for life safety, and there was one for the health and care requirements. And they worked down through this list and they actually left you a copy of the list when they exited. And that has evolved today into the requirements that are, if you use the American Healthcare Association's what I call the red book, I think a lot of people do too, the standard for that is probably 4 inches deep, and it's narrative. It's not line by line by line with X number of lines in a met, not met. It's not that simple. CMS has evolved in a regulatory sense away from that list of task items, to-dos, into a regulation that for the first time when I read it, I said, oh my gosh, they recognize we're not all the same. Every nursing, as I've said to many administrators in training through the years, a nursing home is not a nursing home is not a nursing home. When you walk through the front door of the place where you're going to be responsible for those lives and those outcomes, you have walked into a unique entity because the people that make it up, the community that it sits in, the healthcare environment that it works as a part of, are unique to that location. And you need to know the uniquenesses in order to be able to successfully operate. CMS finally wrote a regulation with F383 that says you're unique. Go out and find out why you're unique. I had never seen that recognition before from a regulatory point of view. And I got really excited. Oh my gosh, they're going to let us operate like any normal business rather than just give us task objective things to comply with. That's the reason why I like this requirement. And that's the reason why I get excited about it. And if I were still an operating administrator, it would simply be an extension of the way we business planned, probably with new enthusiasm. Because your best marketing plan is always driven by what does your community need. It doesn't drive by, is it, what is it trendy to have memory care? It's, do we need memory care in our community? And if so, how much? How many people are there within a given radius that are likely to consume that? And more importantly, are there enough people available to provide high quality memory care? Do I have access to training? Training's easy today. You've got people like NICE and many other online training providers that can help, including the Alzheimer's Association. But memory care training is available. But are there enough people? Because that is a very intense direct care line of business. If you're in skilled nursing and you say, okay, we've got need for dialysis care. Maybe you do have people in your community that are suffering with kidney failure and need dialysis. Do you have access to the supplies and services that are needed for dialysis care? And if so, how often can you get them? How often can you get supplies delivered? Is there a nephrologist close? Is there, how far are we going to be transporting people? How long are they going to be in the van or the bus before they hopefully not ambulance, but that does happen with stretcher transport. But how long are they going to travel? And how's that going to impact their quality of life? Should we really do this? Or is that person better served if they are closer to where those services are at? So just those are the kinds of things that I think about when I think about facility assessment, is not just the list of to-dos that are in the regulation to identify the residence needs that you currently have, but I also look at it in terms of business planning, that as we look forward and we think there are things that we could do, should do, want to do, maybe we're trying to occupy beds, and I need to know how to do that. And it's a reality that I need to be concerned with occupancy as an operator, because my primary responsibility to the rest of the team is to make sure that they have adequate resources to do their job, to make sure that they're paid well. And so marketing becomes real, but I don't want to just go out and try to sell a service that I can't support. And the facility assessment says, know what your current needs of your residents are, know what your current staff capabilities are, know what resources and what systems that you and processes you need to have in place. But I think it also, if you go deeper, it also tells us to look at, what do we want to do? What do others want us to do? Can we do it? What training do we need, et cetera? And if you go forward to the next slide, I think that kind of logically takes us into the most, I think one of the most important things that I can say about facility assessment today is it's not another task. And the reason why I love the regulation is that it's not another task. It is a way of doing business, and it's not something I want to encourage everybody, don't just do it. Do it well. And in order to do it well, you want to involve all the staff. And NICE is as Alyssa said, it is we're a partner company to the National Association of Healthcare Assistants, NAHCA, who probably some of you are familiar with. And we care about how nursing assistants see their organizations that they work in. We want them to deliver person-centered care. We want them to be good, responsible members of the team. And we want them to have strong, healthy environments to work in, where they can be paid equitably for the work that they do, and have recognition of their other needs for things like health insurance and time off. And all of those things involve a good, healthy business to be able to do. And so NICE and NAHCA are also concerned about good, healthy businesses and best practices to get there. Facility assessment, and doing a good, deep, well thought out facility assessment, and involving your direct care people, and not just nursing assistants, but all of the members of the team that participate in this, the dietary aides, the housekeeping staff, the laundry staff, every the resident council, the residents, if they're capable of participating, all those voices can give you fabulous pearls of wisdom to take into your development of your facility assessment and your operating plans. And I want to propose that it's not a meeting. Facility assessment is not a committee. It can have a steering committee, a driving committee, actually must have, by regulation, you've got to produce, a certain amount of structure to that and involvement of the right people. But it's everyone that needs to participate, and they need to participate for two reasons. And there's probably a dozen reasons, but for two primary reasons that I see. And one is, you need to know what they know in order to have a good plan, and they need to know what that facility assessment says the plan is, so that they can do it and that they can articulate it. Because when they're asked by the inspector about the things that they do, and the plans that the facility has for things like a disaster, or how did you decide that you needed 7 nurses aides for this shift, for this unit, whatever, for this neighborhood, the staff needs to know where that came from. Well, we have these conversations, we had these meetings, and those folks that can give you that best information are the people that are doing it, obviously. And I want to encourage you that by walking around and seeing what people do, at the time they do it, where they do it, how they do it, opens doors and sheds light. People are, if you sit down at a table and you start asking questions, some people aren't comfortable with that and they sort of choke or don't say what they think they could say. But if you walk up to them while they're doing their job and you say, wow, that's wonderful, that's interesting, tell me about it, that's the moment that you're going to get that pearl of information. I'd be able to do this a whole lot better if, or this resident would be so much happier when. There, and that's the kind of information that I think goes into a deep, well thought out, well planned facility assessment. Move on to the next slide, if you would, please. There's a story I want to tell you that goes along with this. In my many years as an administrator, I was fortunate to get somewhat smarter over time. Not always. Sometimes I made the same mistakes that I always made, but every now and then I'd get smart and do something better. And usually it's because I heard something that somebody said, and it woke up some gray cells that had been sleeping prior to that. As we increased the acuity and saw the expectations of multiple payers, insurance companies, not just traditional Medicare, but the early days of managed care and skilled nursing, their expectations of us were far different than what we had expected from us when we looked at our operation more from a regulatory point of view. When we looked at it from a payer point of view, it opened up new needs that we had to meet. One of those was more nurses on every shift, 7 days a week. So we went out and found nurses. And at first it was a struggle. We had to look at all those things you have to look at, pay, benefits, working conditions, where this resource is going to be used here now. Where are we going to get it from? Who's going to give it up, so to speak? How are we going to make that happen? And we found at first that we turned over a number of nurses, that we weren't hiring the right people, and that we weren't preparing those people the right way, and hiring and preparing these higher wage employees and turning them over was even more significant to our operation at the time than nursing assistants, where we had sort of addressed some of the retention needs that helped us not throw away money on turnover. And the story, though, that's valuable to me is this. I was walking down the hall one day with the director of nursing and a nurse candidate, a registered nurse candidate that was going to be a part of our chemotherapy team. And so she was kind of a specialized human being that we really wanted to get on board so that we could provide a service that was wanted by our hospital organizations here in the town where we operated. And this nurse was smart enough, when we walked past one of the other nurses on the payroll, to ask a question. She said, "Why do you like working here?" Because I think either myself or the director of nursing had pointed out, so-and-so's worked here for 10 years and she's a valuable member of the team. And this individual that we were touring and interviewing grabbed a hold of that, and they said, so why have you been here that long? Our nurse said, "It's the most organized place I've ever worked." And that's ignited a conversation between these two people that completely knocked me off my feet. Organized? That was never anything I expected somebody to say as a top reason to retain employees. And I learned that day what that meant. We had struggled through supply availability as a facility. I was brought up to believe that you have to lock the storeroom and limit access and keep a running inventory, and that this is a penny business and we have to monitor our pennies. I learned from the staff that monitoring those pennies the way I was trained to do it when I was an early administrator was costing us tens of thousands of dollars. Because every time a person can't go get what they need to get what they need to get done in a timely fashion, there's all kinds of soft cost loss associated with that. People are frustrated, the job doesn't get done, the resident doesn't get their needs met timely, whatever. If you just stop and think about that. So, how much do we spend on toothbrushes? Do we really need to have Fort Knox security? It's a little exaggerated, but it it goes on every day. And we've learned, no, we don't. We need to empower people to understand, don't throw things away that you don't need to throw away, use things wisely, understand, the business and how the business operates. And we trained our frontline staff to be aware of that. We trained our nurses to be aware of supply use and supply costs and how that impacts the resident as well as the organization. And we've, over time, loosened up supply access. What we learned in monitoring this was how significant this was, and it led to that nurse that day saying we were organized. What she meant was that she was able to do her job to the best of her ability and not be hindered by administrative or process obstacles. That day has never left my mind, never will. There's others, I can tell you other stories, and you all have them as well. But I encourage you again, know, see, listen, ask, talk all the time, and keep that facilities assessment alive. And that's probably the best segue into the next slide I can think of. I see the facility assessment as a living document. And it shouldn't sit on a shelf, by the way. It's not something you do and put away. I think it's something that you share, you keep it on I would have mine on my desk. I used to have a survey ready notebook. A lot of people use those. And that survey ready notebook always the pages got dirty and raggedy. And we started putting them in sheet protectors because we handled it so much. And so many people had access to that document. But that's one of the ways that we trained and educated our staff to be ready for a surveyor to walk in at any time on any day and have things available for them. And we expanded it. And we used to have surveyors comment about, why do you put so much in here? Well, we would find we would have to go back and glean out the extra things because we would turn it into a tool. And it would no longer be just what the surveyor needed, it'd be what we wanted it to be. And I think you'll find that with your facility assessment too, that as you keep it alive, you're going to find out that you're doing more and more and more, and periodically you'll want to pare it down. Last, but not least, and actually it's not last, I want to talk a little bit about resources, but the facility assessment here recently came up just prior to our conversation today. And I had to laugh because I said, see, I told you, CMS takes this facility assessment thing a little more seriously than we did. A lot of people, when the regulation first came out, I had a lot of colleagues and career long administrative friends say it's just another task. They're just giving us another thing to do and forms to fill out. And I used to say, nope, I think CMS is trying to change the way they treat us. And I wonder if we shouldn't grab a hold of this and really take it serious and take it to heart and say to them, see, we do understand. We understand that we're not a regulation driven business. We understand that we are a care driven business with people. People are who we take care of. We take care of them with people, and we live in the community with people, and we take taxpayer dollars to do this care with, and we understand that. And we will do that responsibly and as comprehensively as we possibly can. And I think facility assessment gives us that opportunity to say that back to CMS. Well, lo and behold, this week or last week, whenever they rolled out the new proposed staffing minimums, there it was. Enhancing the facility assessment is in the proposed staffing minimums, because all along it said you need to know what staff you need, what kinds of staff, how to prepare those staff. Do they have the proper training? And not, we can't tell you because your resident population, your community is unique, your staff is unique. They reminded us again with the minimum staffing proposal. And I encourage you, when you read that, as I'm sure you all have or will, hopefully you'll comment. But see in there where once again CMS is telling us we're not done with facility assessment. It has a future. The last thing that I'd like to talk about, and that's in the next slide, is just some unusual resources. The first thing I put out here is not unusual. There is, of course, a many facility assessment tools, but there is one by the QIO organization that I think does a nice job and has the process with it. Don't reinvent the wheel, do what somebody else has. So just have a form if you're at that phase of facility assessment. A link to the nursing home help page for CMS, where you can get to the clinical element pathways and the regulations and all the things that you need to make sure that compliance is a part of your facility assessment. But more importantly, there's other places that you can go, and hopefully something on here is new to everybody, and that made it worth your time today. But CMS.gov data will tell you a lot about the hospitals in your area and the other nursing homes in your area, and there's just a wealth of data out there. There was no way for me to even summarize, and I could give you a clip, but it's a place I go to find out what's going on in the healthcare community in my area. The American Hospital Association also has that data. You have to pay to get access to it, but historically I've found that if I'm really doing a first good analysis of what's happening in the hospitals in the area that I operate in, that this is a good place to go and probably a worthwhile investment. Census data tells you what's happening with people. Are they moving to our area? Are they moving away from our area? What is their socioeconomic status? And all the age. What do I need to know about what's been happening and what's likely to happen? CMS.gov has a huge wealth of census data that you can drill down to a state level and a county level. I can't remember off the top of my head if you can go city. It may be urban, or the way the government defines geographic areas, but you can drill down into that data and it's relatively easy to use. The nursing database that I've linked here is a place where you can find information about licensed nurses or professional nurses in their specialties in your area. And that, again, you probably have to pay for that data, but maybe a worthwhile investment. Usually you can also access that sort of information from your state. Whether they charge for that or not is going to be up to that state. And it's typically going to be a raw list, not necessarily the database style listing that you'll find at Nursing Database, but you can find out how many nurses are in this geographic area, and are those nurses are their specialties? Is there anyone in this area? So if I want to do chemotherapy, how many chemotherapy certified nurses actually are in the area? If I want to get into dialysis treatment, how many dialysis clinics are out there is another piece of data. And I didn't put that link in here on how to find out about that, but all of that information is available and actually really easily available. I linked to the Baldrige Performance Excellence because everything in the process of doing a good business plan or having a really deep, robust facility assessment, I think aligns perfectly with the Baldrige Performance Excellence tools and resources. And that can also help you to educate your staff and to use to interest your staff. And maybe one of these days get you a Baldrige Performance Award, which would be pretty cool. It was one of my dreams as a nursing home administrator that I never achieved, by the way. I did not get that done, regretfully so. The American Civil Defense Association, a great place to go to find tools and resources about how your emergency response system works in your area so that you can understand. Again, when you're thinking about particularly dementia patients that need to be managed in an offsite evacuation, those that's a big job. And your civil defense in your area needs to be aware that you deliver memory care and how many people, and if you had to move those people off site, what does that mean? You want to be in communication with your local civil defense, but there's also tools and resources to help you in that planning at this website. The Oceanic and Atmospheric, almost cannot say that. The Oceanic and Atmospheric Administration is a weather site. So I can find out on there weather patterns, likely weather events, what's the history of weather events, know what I need to plan for, how many days are over 100 degrees or over, because weather events are not just hurricanes and tornadoes. Weather events are hot, extremely hot stretch weather, um, hot, dry, extremely cold, especially again, if you're doing specialty care. If I'm transporting residents and they have to leave the facility routinely to go for radiation treatments, how many times am I going to be taking that person out into extremely cold weather, and are we adequately prepared for that? Or how many times are we taking that individual out in extreme heat and they're traveling in extreme heat, and are we prepared for that? And is the transport prepared for that? That's something you want to think about and include, that has not only a quality of life impact, but a direct health impact on that individual. The other interesting use for NOAA information is this. If you ever have a person who leaves the building and you have to do an investigation for the determination of immediate jeopardy, NOAA will tell you exactly what the weather was at the time in your location that the event occurred, and you can document that to help show in your investigation that the individual was not at greater risk for harm than they were just by opening the door and walking outside. If it wasn't 110 degrees outside, if it was 80, there was no rain, et cetera, that helps I think put a little defense in your. That's that's a side tip, has nothing to do with facility assessment. Again, something taught to me by someone else that I give credit for being one of the smartest operators I ever knew. And the last thing I put down here was the Rural Health Information Hub. Again, a great source of information about if you're operating in a rural area, what's available to you and what's not available to you. Rural healthcare delivery and specialty services, or any services, is extremely complex, and it is complex in not just labor availability, but types of people. Again, if I'm going to do any kind of nutritionally specialized care, how much access do I have to a dietitian? If I don't have, so maybe I need a dietitian on site, maybe, or on staff. And if I can't recruit and hire a dietitian, do I have enough access to other dietitians in the area? Just another example of how research and facility assessment are combined. And with that, I'm gonna hush and allow some time here for some conversation questions. I'd like to hear other people's ideas for how to make a facility assessment more robust.
Wonderful. If you want to unmute yourself, you have the ability to do so. If you're having some problems with the microphone, please feel free to type in any message in the chat box, and we'll be sure to convey that.
Cindy, while we're waiting, I appreciate the information that you've shared. This is Chris, and I found that NOAA, as I generally call it here in Southeast North Carolina, is also carries a lot of information, for example, on flood zones and things of that nature, that show you if a river is at this level, that these roads will flood. There will be up to 2 feet of water in these addresses and that kind of thing. And there are a lot of rivers here in my part of the world.
Perfect.
And so that's information that's very valuable to providers. We've got Deneen says, thank you so much for a very informative and entertaining presentation. And that's all that's in the chat right now.
I had a question for you, Cindy, which is not necessarily about the best practices on facility assessment, but I am curious. You brought up so many wonderful points and the value of including this with our entire team and giving them that comfort and letting them know what's planned and giving them insight into having an impact on planning. Do you have any recommendations on the best way that you've seen or the best way that you think that we can provide this very expansive document into digestible pieces for our frontline team members?
I will share with you how the individual who helped in the organization that I worked with for many years, we had a certified nursing assistant who was, he was an admin assist to me. Through over time, he was an individual who developed and was smart and quick and a wonderful communication master. And so I had an opportunity to move him into a role where he took what some people might call a nurse educator's role. He was the individual who took that role on for staff development and education and communication as an admin assist. And he created a newsletter. To this day, even though I'm retired and I've sorted through all my retirement stuff 3 times and downsized it every time, because I say, why are you hanging on to that? You don't need that anymore. But I still have a set of newsletters that he created because I so loved how he did this. He would take a just simple 1-page newsletter feature and then tweak it just slightly so that it was a newsletter that went to the staff, or newsletter that went to the residents, and a newsletter that went to the families. It was the same information, but the perspective and the delivery was tooled to the audience. And he would focus on, he had a list that he developed with input from others, a list of featured topics. And those featured topics would be things like, just prior to the tornado season here in our neck of the woods, which is probably the equivalent to that river flooding, Christine, is keeping an eye on, what's happening in the tornado season. And just prior to the hot spells, just prior, we would do a newsletter feature and remind people and point out the things that they needed to know. It also was an ongoing reminder to talk to us, to say, we need to hear from you. Is this working? Do you have access? And that's how we did it. And I think that was a very effective, probably one of the best tools I ever consistently heard feedback on from, especially family members. Found that incredibly useful. And they didn't realize that we trained our staff as well as we did until they started to see in this newsletter, and they understood the concept was, this is the same information we're giving to our staff and that we've given to your family member for the purposes of the family, though it may have just a slightly different message. But they learned through that process that we did this, and I don't think they really knew that we did. I think the residents did. The residents that were cognitively capable of comprehending it knew that we had the staff meetings, that they'd hear the staff talking about stuff, and so the residents were more aware, but families were not aware. The staff appreciated it because it was short, concise, didn't pull them off the floor for additional meetings. It was a way to communicate that worked with their needs. And they could put it in their pocket and take it home, and they could keep it if they thought it was something that they needed to be able to reference. And so that's my suggestion. I wonder if anybody else on the line has any successful tools that they've used. I think today we text, by the way. I think our newsletter today might be, in today's world, might be a text.
That's true. And there's some really nice programs that are set up with a lot of the HR products that have um, like blog type posts and things that you can engage in and send emojis or I think they're emojis or emoticons that you can send through and recognize. There's some pretty cool programs out there and software systems that are being developed to support that ongoing education and that communication, that flow of communication back and forth too.
Yes. Tools today are wonderful. As just before we started, you brought up robotics and, just the data collection tools that we have. If you have electronic record systems, the data collection and the artificial intelligence that's available today to monitor, to evaluate, when do you have call offs and, what days, what times, and you can immediately go to somebody and say why, and not because you're in trouble, because I want to understand how to fix this or how to prepare for it. Because when the flu season hits and the residents get sick, the staff gets sick too. So are we prepared in advance, and do we sort of understand that about 10% of our staff every year will get the same infection that the residents have? So we need to have a 10% call out plan. I know that's a little oversimplified, but really you can use data from data collection tools that are available to you. You're feeding information into machines. Use that information to help create these robust plans.
Yeah. Yeah, I think the most success that we had with transitioning reportable numbers, internal reportable numbers into actual practice, to your point, assessment, was looking at our retention and turnover data and seeing that we continue to see a decrease in our turnover data. So our numbers were getting lower, better, but our retention data was not increasing. It was kind of holding the same. And we were able to find out when we looked at it, our retention impact was related to 2 positions in our assignments for our nursing assistants. So the 20 positions we had on day and afternoon shifts, 2 positions continually turned over and moved to other positions or other shifts. And to go back to up, we found it was the acuity mix and the support wasn't equal. And those were really difficult positions, and we couldn't keep people in that data, those spots. So
isn't that a diamond?
So back then is looking at what our needs were, what our acuity mix was, how that plays into what our forecasted needs for the building was, all developed back into that facility assessment and into those bigger operating plans on how to support the team.
Wonderful. That's a great case study. Absolutely wonderful.
And Cindy, I really like your point about talking with the people who actually do the work while they're doing the work. I had a facility that had some problems with infection control, and they found, they had educated and they had done all of these things, and they weren't seeing any movement. And so then they got the new leadership, and the new leadership had a different management style. They went out and stood elbow to elbow with people while they worked and said, how do you do this? Show me how you do it, because I want to learn. I want to learn what works for you. And when they did that, they found out that because the cleaning agents were locked in the closet on the end of B wing, things weren't getting cleaned the way they should be on A wing because people had run out of the resource that was necessary to make it happen. And they didn't have the time to go to the other end of another wing, almost a block away, if you looked at city blocks, to get it. And so they had that recognition, and they were able to affect change by simply moving supplies. That was all it took to improve those numbers. But somebody had to listen to the problem first. And so I really do appreciate the way you put that.
Well, and you just articulated a beautiful story to reinforce the point. I'm thrilled that I think that is such a common, it's hard if you pull me out of my element and we sit down and we try to talk about something, I won't remember all those little details about what I do. It's just not the way my hands and my brain are linked are more linked than that. But if you talk to me when my hands are in the middle of what I'm doing, that's when I can tell you. That's when I can actually articulate it. And you just told the perfect story to go with that. Thank you.
Thank you for joining us today. There's nothing else in the chat.
Well, we will be posting this information and have it available on our YouTube channel if anybody wants to watch the archive, refer back to it. Always good to have a good tool in that resource kit that we look forward to. Cindy, thank you so much for a wonderful conversation and presentation. This has been extraordinarily beneficial to all of us. And
you.
And for everyone else, if you have any ideas, suggestions, or needs, please let us know. We're here to help you, and we will help us pick up any resources.
Alyssa seems to be cutting out very, very badly now. But I can tell you what she's saying is thank you so much for joining us. And should you have anything that you're interested in seeing or hearing about, please do feel free to reach out to us, and we will certainly see what we can do to find someone to give us that information. And we look forward to seeing you next time.
Thank you.